Hello, my name is Catherine Rutland. I'm Clinical Director at Denplan, part of Simplyhealth. Good to speak to you again. It's been a little while since my last podcast, lot going on last week. I think what's really interesting in this time frame, and as time shifts and we move on into week whatever we are now, is how people's viewpoints are starting to change and actually becoming so much more forward focused. That's what I've really noticed in the last week, from everybody sort of much as not hugely comfortable with the status quo as it is at the moment. There is now time for people to actually start to think about what is the exit strategy for this, how is it going to work. We are doing a huge amount of work. Obviously, it's very difficult. Research, as you know, is very early for even other countries that have gone through it. Still very early days. So the research is very mixed, and it's very difficult to know what to actually hang your hat on, so to speak. We also, of course, will have to follow whatever guidance comes out from Public Health England and how we adjust the rest of our lives as well, not just dentistry. But rest assured that we are doing a lot and a lot going on behind the scenes, a lot of conversations, speaking to different organisations to understand where we can fit in and where we can help and where we can be to aid you when we start to get more clarity and come through this. I think one of the interesting things that I've found through this, though, as well, is much as we're all learning a lot about this situation, one of the areas that I'm really starting to understand is a bit more around the press and how it works, and reputations and consumer side and so on. Very different perspective to sometimes as a profession, we think. And one of the interesting sides of that is this learning of what are we going to come through this as a profession from a reputational perspective. I think standardly we worry about our local reputation for our practice and how we work and our staff and so on. But with this and with looking at how the press are acting, they are definitely looking at where are the good people, where are the bad people, what are the good professions, what are the bad industries. It's all there. So just something to be really mindful of at this time, because as I say, I've certainly learned a lot in the last few weeks. Can I also encourage you as well to make sure that you are there for your patients? I know most of you are hugely, but one of the interesting things I think through speaking to somebody external to dentistry recently is this fact that our prime person normally for speaking to patients at the front line, doing everything they do, is our receptionists. And of course, they were, in almost all practices, some of the first people to be furloughed. And I think from what I see from some dentists, they are struggling to suddenly those parts of the practice that we never normally touch, being on the phone all the time, picking up emails, responding to initial patient queries. That's not our bag usually. And with most of practice teams furloughed, dentists are now suddenly having to do roles that they're not used to doing, and it creates a little bit more of a challenge. I know from having spoken to some of you. Some of you find it very easy, but some definitely more challenging. And what I would say is make sure you tell your receptionists how much you do appreciate them. I know I've said it before about your teams. I know they're not there with you at the moment for most of you, but, do make sure that you show them you appreciate them. Really, really important. Webinars still going from strength to strength, so please do look at those. Over 21,000 views. And people are finding that structure of having it booked in, knowing when they're going to sit down and being part of the wider profession, even if it's just for an hour or so a day or a few times a week, is a really good connecting point at this point when, for a lot of us, we do feel quite isolated. So please look at those. There's some new ones going into that. I must get myself sorted and get mine in order for a few weeks' time. So it's a great thing, though, to get involved and just learn something different and keep your CPD up. So I think that's it really for today. Won't make it too long. Just want to wish you all well. I know this is just so challenging and worrying in so many senses. And it is everywhere, and it is for everybody, and I think that's what we see. It's not just our profession that is suffering. There are so many areas. I know through work that goes on in my team of connections with physios, with osteopaths, with opticians, they are all struggling too. A lot of them are all small businesses, although their cross-infection issues are not to the same degree as us, they are also going to be in a position of potential restriction and change when they go back to work. So we aren't the only ones, and I think we need to remember that sometimes. There are a lot of other people going through the same, or not quite the same, but similar difficulties, and on top of that, all the emotional and personal issues that are going on at the same time. So just keep yourself safe, look after yourselves, and we'll speak to you soon. Okay, bye.